Hello, I'm Harry Cayton. I run the Professional Standards Authority for Health and Social Care in the UK. But I've spent 30 years working in charities, in government, in campaigning organisations, trying to improve health and social care services, mainly in my case for disabled children and their families, and also for older people with dementia. So I'm going to talk briefly about ways in which you can influence and bring about change in the health systems in your country. There are principles that apply generally, and you have to think about how you use them locally and how you use the skills that you have locally to make the changes happen that you want. The first thing I would suggest is you need to know your people. You need to know who it is in your country that is influential, who it is that makes the decisions that matter, who it is can create a barrier for you, and who it is who will bring about change. If you understand those people, then you can begin to think about how to influence them. They won't always be the same people in certain countries, and they won't always be the most powerful politicians. Secondly, you need to know your facts. You need to really have the information that you want at your fingertips. You need to know, for instance, how many children are at risk in your country. You need to know the cost of putting things right. You need to know how many clinics, how many doctors, how many nurses would be involved. The more facts you have, the more information you have, the more persuasive you will be. You need to have patience and persistence. Change doesn't come about quickly and it doesn't come about easily, but it needs to be determined over time and brought about over time. So you mustn't be ready to give up easily. You must always think, can I do that again? Can I do some more? Can I continue? Because eventually change will come about. I think then you have to have planning. You have to think about your tactics, your strategy, your way ahead. You have to think about step-by-step change. Don't always go for the biggest and most important. You can bring about change for individual children. You can bring about change for individual families. You can bring about change in one village or one clinic or one town. You don't have to do everything first at national level. And as change comes about slowly, others will see the benefits and others will be able to imitate and to go forward with you. And so finally, you need to build alliances. You need to find out who shares your vision of change, who wants to work with you to make things better and safer for children. Who can you enlist to your cause? Because there will be lots of people, other clinical and medical colleagues, scientific colleagues, members of the public, families, doctors, nurses, clinics, all will be able to come on your side. And you can build a movement for change slowly over time, almost independently, I believe, of the powerful politicians who may or may not be supportive of what you want to bring about. So a lot to do, a lot to learn. Persistence, planning, perseverance are really important. Know your people and know your facts, and I believe that you can work out for yourselves how best to deliver change in your own situation and your own countries, and I wish you luck.